From LPM,
Louisville Public Media.
Why does the United States pay higher drug prices than other countries? Because America's the only country in the world where 340B hospitals mark up drug prices and PBM middlemen charge billions in hidden fees. Meanwhile, Americans subsidize the research and development for new cures. Other countries benefit, but don't pay their fair share. Crack down on the middlemen. End the free riding. Lower drug prices. Go to balancethescales.org to learn more. Paid for by Pharma.
Welcome to On Track. I'm Aisha Jaffer. Medicaid is the backbone of healthcare access in Kentucky, especially in rural and Appalachian communities where many families rely on it for basic services. But a sweeping federal bill, which the White House called the One Big Beautiful Bill Act, that recently passed could dramatically shrink the program, potentially cutting off coverage for thousands of Kentuckians and threatening the future of rural health providers. So how does this bill work? What does it impact most? And how are state and industry leaders responding? To help break it down, we're joined by Kentucky Public Radio's Capitol reporter Sylvia Goodman and Enterprise State House reporter Joe Sonka, who've been closely following the bill. Sylvia, Joe, welcome to On Track.
Glad to be here.
Thanks.
So I'm going to start with you, Joe. What changes to Medicaid are actually in the Big Beautiful Bill, and why has it sparked so much concern in Kentucky?
Well, I'd say there are two big changes. One was in the first bill that passed the House. It adds new work reporting requirements for anyone who to be eligible for Medicaid coverage. Also adds more frequent eligibility checks for people. So this was estimated to drop as much as 8 million people nationwide to lose their Medicaid, around 250,000 in Kentucky. Then the bill came to the Senate, and the Senate added new cuts to state-directed payments and provider taxes, which in Kentucky really go to fund hospitals. Hospitals get more than $2 billion a year from this fund in Kentucky, and that was cut by a large amount. So the total bill that passed into law cut more than $1 trillion from Medicaid over the next decade. And that has a lot of people, a lot of healthcare providers and healthcare advocates in Kentucky worried about what that's going to look like in Kentucky, especially the rural areas of the state that are especially dependent on Medicaid.
So why were these changes made? What's the argument from lawmakers who supported the bill?
So I would say it's the same argument that's being made for a lot of cuts that the White House is proposing these days, which is eliminating waste, fraud, and abuse. For work reporting requirements, Republicans say it's to rule out people who Medicaid was not meant to serve, that it's not meant for people who are just choosing not to work. Now, advocates say that work requirements really mostly amount to work reporting requirements, that it really is just about people making people report more, and then people fall through the cracks because they fill out a form wrong or don't accurately report how much they're working, things like that, because data does show that most people on Medicaid are working. It's a really small amount of people who are not working and just getting Medicaid.
And Sylvia, I want to ask you, we were talking about the stricter work requirements for some of the Medicaid recipients. What do those requirements look like here in Kentucky? What kinds of challenges, like you said, paperwork is one of them, could they create for those getting access?
Well, we don't exactly know what the work reporting requirements will look like in Kentucky, so there's some room for states to decide how they're going to implement those. But essentially, it requires people to prove that in the last, month or so, that they have worked a certain amount in order to gain Medicaid, and then those checks happen periodically. And then also these eligibility checks happen, every 6 months, Joe?
Yeah.
They used to be once a year. So they're just ramping up how often you have to fill out this paperwork to prove that you're both eligible, and then they're adding this requirement that you work. And the fear from advocates, like I said, is about that people just don't fill out paperwork right, or that the work reporting requirements don't accurately depict people who aren't able to work. So, for example, if you have cancer, for something like that, right? It's would the work reporting requirements count that as a disability? A lot of people say they should, right? But is that written accurately into the law? How do we define disability? How do we define able-bodied? Things like that. There's a lot of fear that allows people to fall through the cracks. And in Arkansas is a great example. They tried to implement work requirements before it was struck down by the courts. And a lot of people who were technically eligible, didn't understand how to report correctly and therefore lost their access to Medicaid.
So how does this law affect Kentucky's Medicaid expansion? What kind of coverage loss are we talking about there?
Well, that could be a lot of the people who may fall in the cracks of the work reporting requirement. So a third of Kentucky is on Medicaid now, and that really changed about a decade ago when Kentucky decided to expand Medicaid to people, basically the working poor, people who have up to 138 of the federal poverty level of their income. And so that dramatically changed Kentucky. It increased the number of people that have insurance, it decreased the number of people who are uninsured. And really in Eastern Kentucky, that has been a boon for both the healthcare providers and the larger economy. There are places in Eastern Kentucky with a lot of sick and unhealthy people who need care, and there have been healthcare providers and hospitals that have popped up and really thrived due to Medicaid expansion because they have patients that they're actually getting reimbursed for instead of treating poor people who come to hospitals sick and they get no reimbursement at all.
So, you're talking about like the expansion and how it sort of has like helped these areas, like in places like Perry County, that's helped transform it into a regional healthcare hub. Up to this point, it sounds like Medicaid has reshaped access to care in rural Kentucky.
Yeah, definitely. We traveled to Hazard in May and went to one clinic that basically was an entire strip mall where a Kmart used to be. And now it's a primary care center where people can go for just an endless number of specialties. There's a pharmacy there, there's pediatric care, there's x-rays. You used to go down the line and there's any kind of primary care possible, people can get there. And in fact, Perry County is one of those counties that has, in terms of healthcare providers per capita, it's near the top in Kentucky. And it didn't always used to be that way. That's really the Medicaid expansion was able to fund reimbursements to keep these businesses, keep these healthcare businesses open, and it's a lot of people who need care, and there are healthcare providers that have popped up that have been able to stay in business because of Medicaid and getting reimbursements.
And we were talking to providers, telling us that they had people coming in who their entire life they had been to a doctor once or twice, someone who's 50, 60 years old, and they're finally finding out they have diabetes, that they have a heart condition, things like that, and they're finally starting to get treatment. That happened with expansion, and, a decade later now, they're starting to see the positive benefits of that, and now we're cutting back on Medicaid.
So what is it about Kentucky that makes us especially vulnerable to these changes?
So we have large rural areas. We have a large number of rural hospitals that operate on pretty thin margins. There was a report out of, I think it was a North Carolina university, that found that Kentucky had 35 hospitals that were at risk of closing should this bill pass. I could imagine that number is even higher. That was before the Senate put in place their additional limitations on state-directed payments, which mean that hospitals don't get a boost to their reimbursements to bring it up to like private insurer levels. And, so those are hospitals that are ultra reliant on Medicaid, that have already really thin margins, or maybe are even in the red frequently. And so, that could mean areas that people have less access to healthcare. They have to drive further to receive care, or maybe they just don't get to care in time, or, for regular checkups.
Yeah, and it was those changes in the Senate bill that really got Kentucky Hospital Association off the sidelines. They were kind of supportive of the House bill because they knew it could be a lot worse. And in the Senate, they found out what it looks like when it's a lot worse. And those payments that are cutting them off, the Hospital Association says that hospitals on average make about 2% profit. And without those funds that they get every year, they would be 7% in the red in the hole. So their estimate is that they employ about 90,000 people in hospitals around the state, and they estimate that 33,000 jobs could be lost from this, and the hospitals could close, staff could be cut back. So they really sounded the alarm at the end when the Senate was pushing forward this bill, and they obviously did not get through to the Kentucky senators and representatives they were trying to.
Yeah, because originally it sounded like they were aligned with Kentucky's Representative Brett Guthrie, who argued the changes were meant to preserve Medicaid long term. But of course, the changes in the Senate, like you said, they called the final law devastating. And it sounds like those changes it had more to do in the bottom line and really quickly.
Yeah, absolutely. In the House, Brett Guthrie really defended his vote and saying, like, look at the Kentucky Hospital Association. They say that we're preserving Medicaid. But that was before, and there were a lot of the primary care healthcare centers and providers in Kentucky were sounding the alarm about the House bill because that could cut in the number of patients that they could treat and be reimbursed for through Medicaid. And the Senate version really affected hospitals more so than the House bill, and that's when they came out and said that this is going to be devastating. But when it came back to the House, those same House members voted for it. So
Yeah, it didn't seem to change anyone's votes, really, at the end of the day. There were two Kentucky Republicans who voted against the bill, Senator Rand Paul and Representative Thomas Massie. However, both of them weren't voting because they didn't like the Medicaid cuts. They were voting against it because they thought more cuts were needed, that this grew the deficit too much, and it does grow the deficit significantly. Thanks to tax cuts that the bill extends and or adds. So that was the reason they voted no. Obviously, also the Democratic representative, the only one in Kentucky, Morgan McGarvey, did also vote no on the bill. And his reasoning was the Medicaid cuts and other cuts in the bill.
And they did have President Donald Trump basically telling them they had to vote for this and had to vote for it quickly. And there was a really speed up process to get that passed before the July 4th weekend. And it does create a large deficit, according to the CBO, the Nonpartisan Congressional Budget Office. This $4.5 trillion of tax cuts over the next decade, and only $1 trillion of cuts. So if you do the math there is a deficit coming in, and it does raise the debt ceiling considerably.
Well, and I'm curious about the numbers. If you know roughly how much funding is Kentucky expected to lose under this new law for Medicaid?
Well, just the House version of the bill, there were estimates that Kentucky could lose more than $2 billion a year. And the Senate version, what the Kentucky Hospital Association is saying is that there is that $2 billion a year annually that they get in these state-directed funds. And they're saying that could be wiped out by as much as 90%. So we are talking billions of dollars. And I should say the state-directed payments in the Senate bill, that does not go into effect until 2028. So there is kind of a period where they're not directly affected, but then in 2028, that's when those state-directed cuts that hospitals rely on will get cut. The work requirements are a little sooner than that they go into effect.
Yeah, and we're going to talk about that a little bit more in detail. But in terms of health coverage and provider strain, what are we actually, we've talked about it a bit, what you've been here, but what are we actually looking at on the ground?
I think that the big concern for primary care physicians is that the people that they have been working over the past decade to build up relationships with and get them into healthcare, that they're going to drop out of the system. In some of these areas, we're talking about people who are really isolated. Some of the people with the worst chronic health conditions, that maybe they, are very housing insecure, things like that, that those are the people who are not going to keep up with work requirements. People with large families who are working multiple jobs and still under that poverty level for expanded Medicaid, that they're the ones who are going to fail to fill out the correct documentation. Gig workers, people who have a really hard time, totaling up what their hours are or proving their hours. Those are the people who get cut off under the work requirements. So from primary care providers' perspective, that's like one of the big concerns, that the people that they're already treating will no longer have coverage. And I think, from the providers we talked to, many of them said they still intend to help those people, that they're not going to turn them away, but that they're going to have some major losses there.
And among the providers that are most concerned are the drug addiction treatment providers, because they almost entirely rely on Medicaid. And Obviously, Appalachian, Kentucky was really ground zero of the opioid epidemic over the past couple decades now. And they fear that all of these treatment centers that have popped up and are able to treat these people now, that they could go out of business if the people that come to them lose their Medicaid, which they're very concerned about.
Are they holding out? Are they all? So it sounds like they're kind of putting plans in place. Are they preparing for cuts or holding out hope for some kind of policy protection from the state?
Well, one of the aspects of this bill is there is a delay on it. So technically speaking, there could be a new Congress that comes in 2026 and reverses some of this before it goes into effect. But that's certainly not a sure thing that Congress is going to flip in some major way. And even if it does, they'll be able to pass something to reverse it. Obviously, the president can veto legislation. So I think everyone's really bracing for what's going to happen. And can the state fill in the gaps here? That's really, people are very skeptical of that because Kentucky is not a very wealthy state, and the state legislature is looking more to cut spending, to cut taxes, and it's kind of unrealistic to think that the state of Kentucky is going to find $2 billion under the couch to help fill in and help the gap and help those hospitals and the Medicaid funding that they're losing.
Let's just say it would be a major, major shift in priorities for the GOP supermajority in Frankfort to start significantly increasing the budget. They would have to totally abandon their stated long-term goal of getting the income tax to zero. That's not going to happen if they really increase spending on Medicaid.
Well, we'll be back with more in a minute. You're on track with Louisville Public Media.
Why does the United States pay higher drug prices than other countries? Because America's the only country in the world where 340B hospitals mark up drug prices and PBM middlemen charge billions in hidden fees. Meanwhile, Americans subsidize the research and development for new cures. Other countries benefit, but don't pay their fair share. Crack down on the middlemen. End the free riding. Lower drug prices. Go to balancethescales.org to learn more. Paid for by Pharma.
Welcome back to On Track. I'm Aisha Jaffer, and we're talking with Kentucky Public Radio's Capitol reporter Sylvia Goodman and Enterprise State House reporter Joe Sonka about the newly passed Big Beautiful Bill Act and what its changes to Medicaid could mean for Kentucky. So beyond healthcare access, what kind of ripple effects are these Medicaid cuts already having or expected to have on Kentucky's economy?
Well, I think that a lot of these impacts are going to be delayed. The cuts go into effect over time, over the next decade. So it won't be an immediate impact on the economy. But we know that hospitals are already bracing. They've put out a lot of statements about how worried they are. The Kentucky Hospital Association, like Joe was saying, has been clear that they expect tens of thousands of jobs to be lost, especially because of the limitation on state-directed payments that's going into effect. But again, that provision of the bill doesn't go into effect for several years. So, we're going to see this over the next decade. There's going to be a lot of elections in between that time. So it's hard to say exactly how this will impact the economy in the short term. But, you have to imagine the hospitals, they have to start planning now for what they're going to do in 2 years, 4 years.
And so, we're talking about this bill and the process of crafting this bill. Did federal lawmakers weigh any exceptions to try to shield rural states like Kentucky?
Well, in the final version of the Senate bill, they did create a $50 billion rural health fund that's over a span of 5 years. So that would be $10 million each year. But if you look at what Kentucky is losing individually annually, it's very doubtful that this is spread around 50 states over 5 years, this fund, if this is going to make up for what Kentucky hospitals are saying that they're losing each year. If they're losing, $1 or $2 billion a year, it's very doubtful that larger rural health fund is going to really fill in the gap.
And we talked about that, it's very unlikely that the state will be able to fill these gaps. But what has the state's response been so far? And are any officials kind of looking at alternatives or trying to approach this?
I think that they're if you ask them, they're still evaluating at the moment. I asked just before the bill passed, I asked our Senate President Robert Stivers, and he was very wary to say anything. At that point, he thought the Kentucky Hospital Association was still on board, and so he pointed to them as being in favor of the bill. Obviously, they have now come out strong opposition. But so far, I would say the Republican leadership in the legislature has been more quiet on the impacts of the bill, and I imagine they're having conversations behind the scenes.
And Governor Andy Beshear has, of course, blasted the bill and said that it's going to do everything that the Kentucky Hospitals Association is saying it's going to do, and all of the healthcare advocates saying it's going to do. What the governor alone doesn't decide what is funded and what is not. So he's doesn't have a great deal of power and influence to be able to do anything to reverse those cuts. But he does have his administration does deal with a lot of health, and they're going to have to be the ones that kind of deal with how do we adapt to this and make it as least painful as possible for people.
Yeah, and I imagine his administration, they're the ones who are implementing, for example, the work requirements. I can see the legislature having some way in there. They can pass their own laws about how they think that should go. But at the end of the day, they're the ones implementing it. So be really curious to see how that plays out as well.
So when do these Medicaid changes officially go into effect?
The state-directed payments, they end in 2028, or the cuts start in 2028. And so if you think about 2028, we will have a new governor. So we don't know really who's going to be the one dealing with the aftermath. If hospitals are losing a couple $1 billion a year and federal payments, that might be up to a new administration, maybe a new party. Maybe that's a Republican governor dealing with how they're going to implement that. The work requirements take place before that. That will be when Governor Beshear is still in office. So they're going to have to each state really can take their own path with work requirements. They can be more stringent, less stringent. It's really up to them in some sense. So that will be a big issue in the next few years about how that specifically looks and how stringent that is, how hard it is for people to go through all the red tape and make sure that if they are working, the government knows that they are working so they can continue to have Medicaid.
And so are there any meaningful alternatives for Kentuckians who stand to lose coverage under Medicaid?
Well, if you don't have coverage and you're not able to go to a primary care doctor to get care, chances are you could get very sick and go to the hospital, and the hospital has to treat you. And unlike before, the hospitals may not be able to get any reimbursements for treating you. So, if you can't go to your primary care doctor because you've lost coverage, you go to the hospital very sick, and that's very expensive for hospitals. And obviously, it's not good for that patient because you should be, cutting certain illnesses and chronic conditions off with a primary care doctor before it elevates to the point where you have to go to a hospital.
Are you seeing anything else, as far as community activation or nonprofit activation to kind of respond to this bill, or it's too soon maybe?
I think it's a little too soon, but I do imagine there's a lot of groups that have been working long term in the state to try to boost health outcomes. The same advocates that we're talking about that have weighed in on this bill, Kentucky Voices for Health, a lot of other groups, I imagine that they will be activating. One of the hospitals or hospital systems, I should say, that has so many groups in Appalachia, in rural areas, is University of Kentucky Health. They have a lot of their network in these rural areas. So obviously a nonprofit, I imagine that they will be doing a lot of work to try and fill in gaps, or maybe ask for the state to help fill in gaps. We just really have to see how these nonprofits are going to try to take the place of groups that have to cut back services because they're not getting as high reimbursements.
Yeah, and the university health services, they were also pretty quiet during the process the bill was in Congress. Once it passed into law, you've had U of L and University of Louisville and University of Kentucky health system saying this is going to be big, and this is going to have a big effect on how we're able to deliver care to people.
So I want to touch on something just a little bit. And earlier, Sylvia, you mentioned this, that, the Kentucky Center for Economic Policy released this report that 35 rural hospitals, maybe more now, in Kentucky are at risk for closure, the highest number in the country. And there were also, in the Medicaid cuts, there were changes to SNAP benefits. And I'm just wondering, how are all these pressures overlapping, and what are you seeing in response?
That's a good question. This bill was so big, right? I think that's kind of what I would say is it has so many different components. They're all definitely overlapping to create this kind of system where people are, maybe going to be a little less healthy, a little more sick. So you mentioned SNAP cuts, I think. We haven't talked about that yet in this conversation, but that was another big piece of this bill. SNAP or food stamps. This bill for the first time would shift some of the cost of food stamps to the state. And that shift is based on the state's unintentional error rate. So how frequently they make over or under payments on accident. And that would shift, I think under the Senate bill, it's about $124 million to the state. Right? We're talking about billions of dollars with Medicaid. So 124 doesn't sound like a lot. It is still a lot for Kentucky. It's a new expense that we'd have to take on. And that includes also a shift in administrative costs towards the state. So, I mean, when you think about that, right, some people are going to lose their Medicaid coverage or their local hospital might cut back services. And you also have people who could lose some of their SNAP benefits if the state is unable or unwilling to fill in that gap. And then we also have under SNAP, they're also increasing the work requirements to include more people. So parents of older children and older adults would be added to work requirements for SNAP. So, we add all of these things together, definitely overlapping pressures on our healthcare system. Obviously, food is part of healthcare, part of being healthy. So it's a lot of overlapping pressures at once.
And it's, again, mostly affecting, it affects everyone throughout the state, but it's mostly Appalachia because you have a dozen or so counties in eastern Kentucky where a majority of people are on SNAP, a majority of people are on Medicaid. So, if you go after cutting SNAP and Medicaid, it's going to affect a lot of people, but particularly that part of eastern Kentucky.
Before I let you both go, if someone's worried about losing coverage or benefits, what can they do right now to stay informed or protect their access?
Protect their access. I mean, like we're saying, a lot of this is about reporting requirements. That's the big thing that this bill does to individuals. So it's going to be really tricky. You have to stay up to date on what the state is doing for work reporting requirements, eligibility checks, all of that stuff. It's really just a game of keeping in touch with what's happening.
Joe?
A lot of the major effects of this bill aren't going to go into effect right away. So I would keep watching and listening to people in the healthcare field to see what you have to do.
Well, Joe, Sylvia, thank you so much for being here on Track.
Happy to be here.
Thank you.
Sylvia Goodman is a Capitol reporter for Kentucky Public Radio, covering the State House since 2023. She previously reported for the Chicago Tribune, Chicago Public Media, and the Chronicle of Higher Education in Washington, D.C. And Joe Sonka is the Enterprise State House reporter for Kentucky Public Radio. He's covered Kentucky politics for nearly 2 decades, with past roles at Leo Weekly, Insider Louisville, and the Courier-Journal, where he was part of the team that won a Pulitzer Prize in 2020. You can find Joe and Sylvia's latest reporting at lpm.org. On Track is a production of Louisville Public Media. The On Track production team includes Michelle Tyree Johnson, Alex Biscardi, and Laura Ellis. Our music is by Kojin Tashiro. If you'd like to revisit this episode or explore other community-focused conversations, visit LouisvilleOnTrack.org or find us in your podcast app. Have feedback or ideas for a future show? Connect with us at 502-814-TALK or ontrack@lpm.org. I'm Aisha Jaffer, and remember, being kind is free. That's the start of community. Until next time, you're on Track with Louisville Public Media.
Why does the United States pay higher drug prices than other countries? Because America's the only country in the world where 340B hospitals mark up drug prices and PBM middlemen charge billions in hidden fees. Meanwhile, Americans subsidize the research and development for new cures. Other countries benefit, but don't pay their fair share. Crack down on the middlemen. End the free riding. Lower drug prices. Go to balancethescales.org to learn more. Paid for by Pharma.